Biological samples for DNA sampling. Profiling. Samples for DNA profiling must be collected using a sterile, uncontaminated cloth. Usual samples to be collected are blood stains on carpet, cloth, floor, tiles, food, furniture, metal, newspaper, plastic, vehicle, wallpaper, wood, etc. When fetus chorionic villus samples, muscle biopsy, hair from a head, must take a beard, axilla, pubic region, nasal mucus, saliva, cigarette butts, envelope, mouth swab, etc. 7. Suspected stain on a cloth, floor tile, furniture, matted hair, generally pubic, paper, vaginal aspirate, swab from anus, mouth, penis, and vagina. Tissue from bone marrow, fingernail scraping, muscles, spleen. Collection. If DNA evidence is not properly documented, collected, packaged, or preserved and forwarded, it will not meet a legal and scientific requirement for admissibility in a court of law. For forensic purposes, samples are usually collected from living person at the scene of crime or at autopsy. This should be sent along with the control sample to DNA typing without any delay. Autopsy tissue samples. Bone marrow. Bone marrow not preferred in a fresh autopsy where muscle is available. In skeletal remains may be tried. Femur and humerus are preferable as they yield more bone marrow. Pack in a clean paper or cloth. No preservative is necessary. Brain not preferred. Kidney not preferred. Liver not preferred because of enzyme degradation of the DNA. Lymph node a good source of DNA. Preserve in a dimethyl sulfoxide. Putrefied bodies take teeth, one long bone, hair generally not useful. Skeleton muscle deep, best for DNA. Skeleton muscle deep muscles best for DNA. Pulp, spleen, good source. Skin 2 to 5 gram. Second best after muscle. Second best after muscle only the skin. Should be stripped of fat as there are difficulties in dissolving fat in the lab. First one is blood. The source yielding the best DNA content is a whole blood. Liquid blood may not be available in all situations. Examples from scene of crime. Therefore, dried blood may be hard to send. Liquid blood have to be taken from living or from relatively fresh dead bodies. Preservative EDTA is preserved. At least 5 ml should be collected in a purple contained vac container EDTA tube from a dead body. Liquid heart blood can be taken in a gauze piece, dried and sent. Clotted blood is not a good source of DNA because of settling out of the WBC. DNA-based forensic odontology. Oral cavity provides several sources of DNA. Mucosal swab, saliva, teeth. Saliva forensic value. Saliva contains desquamated epithelial cells. DNA can be extracted from this. Collected from the living. A whole saliva is collected normally either as a rusting or stimulated chewing or paraffin or using a small citric acid crystals. Collection from dead. For identification of assailant may be necessary if dead body shows bite marks or liquid regions. For identification of victim rarely needed. Example, if victim had a blood transfusion during last 3 months, it is not advisable to take blood or organs perfused with the blood. Procedure. Suspect area swabbed with the distilled water, swab dried, moist condition. In moist condition, there is danger of bacterial and fungal growth and send it to lab. Take swab from mouth in case of victim identification. Then teeth. Useful because teeth resist mass disaster and genetic material is protected by the calcified tissue. If skull containing teeth is available, detach molar teeth from upper and lower jaws and send in paper bag. If molar teeth are not available, send other teeth, clean and stored in a normal saline. Sources of DNA are dentine, pulp, cement, periodontal fibers, and attached bone fragments. Dentine consists of a cellular extension, Tommy's fibers, rich in mitochondria. Dentine contain rich in mitochondria. Dentin powder is therefore presumably a good source of mitochondrial DNA. Pulp tissue most commonly used because it is abundant and has least chance of contamination by non-human DNA. Pulp tissue. Fingernail scrapings. Useful in sexual assault cases. A procedure. Place a palm of victim on a clean paper. Scrap near a portion of the fingernail with a toothpick or fold a paper and send. Semen and vaginal swabs. Useful in rape cases. Air dried and sent in paper envelope. They are porous and do not allow moisture to develop. Polyethylene envelope are not be used because they are not non-porous. Moisture develops a fungal growth, degradation of DNA. So porous item will be used. Okay, in semen and vaginal swab. Amount of DNA recovered from various biological material. Blood 20 to 40. Blood stains 200 microgram. Hair 0 to 1 to hair plucked 1 to 750 microgram. Saliva 0.5 to 190. Semen 2. Urinary tract cell 1 to 20 microgram per ml. Vaginal swab 150 to 300 microgram per ml. Miscellaneous blanket, clothing, pillows, sheets, blood, semen, saliva, hair, bullet, blood. Okay. Cigarette butt, saliva, condom, semen, vaginal secretion outside, drinking vessel, saliva, envelope, flap, saliva, fetal and maternal tissue separate at the time of collection. Gas hat, mask. Gag hat at a mask, set saliva, hair. Hair pulled from a dead body so that nucleated root or follicle cells are available in sufficient numbers. Generally 10 hair are sufficient. Naturally shed hair as from combs and hair brushes may have little or no root material. Send hair only when nothing else is available. Not to be used as first choice. Postage stamp. Saliva weapon. Saliva weapon blood. Preservation. Freezing dust. Dust. Place a tissue in aluminum foil. Put foil in a plastic bag. Freeze up to 5 days. Up to 5 days may be stored in ice. Up to 5 weeks minus 70 degrees Celsius. Minus 70. Dried objects like bone, dried blood stains, etc. need no preservative. Bone no, I think blood stains no need any preservative. Formalin never preserve in formalin. Never preserve in formalin. It destroys the DNA. Authentication and forwarding. For paternity disputes, blood samples should be taken in the presence of a judicial officer. If samples are taken from autopsy, such a procedure is not needed. Sealing. Sample should be sealed and a specimen of seal number should be sent separately on a plain paper. A signed identification label should be placed on all samples. Forward noting should accompany sample stating clearly what the sample is from, where it has been taken, and what exactly is required. Why, if person has had a blood transfusion within last 3 months may lead to error. In such cases, other samples, saliva may be sent. Thank you.